Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Gout Show, your go-to podcast for all things gout-related. We're here to guide you through the ins and outs of this ancient yet often misunderstood health condition. Through interviews with experts and fellow patients, we'll explore the basics, debunk myths, and arm you with the knowledge you need to take control of your health. Whether you're newly diagnosed or a seasoned veteran, there's something here for everyone. We have three wonderful guests with us today: patient advocate Gary Ho, rheumatologist Dr. Chris Parker, and nephrologist Dr. Nissreen Elfadawy. So sit back, relax, and let's dive into The Gout Show.
Hello, I'm Dr. Chris Parker, rheumatologist. I practice in Austin, Texas. I became a rheumatologist in 1997, and over the years, my interest has grown so that I not only get to see gout every day in clinic, but I publish in the area, I do research in this area, and with my partner, Gary, who we're going to be talking with here shortly, we are the founders of the Gout Support Group of America.
Thank you, Chris. I am super happy to be here. So I'm a patient advocate, lived with gout since 1994, and spent over a decade trying to find a diagnosis for this crazy, awful condition.
Hello, everyone. This is Dr. Elfadawy. I am a nephrologist at Cleveland, Ohio. I practice nephrology, transplant nephrology, and recently I grew a big interest in treating gout and taking care of chronic gouty patients. I'm so happy to be today with Dr. Parker and Gary to share our thoughts, and I hope that will be a very interesting podcast to everyone. So to start this episode, Dr. Parker, I'd be curious to know, as a healthcare professional, I feel like we have heard it all. What's the one myth about gout that you want to debunk once and for all among your patients?
Yeah, okay. So the one myth that I try to debunk all day, every day in clinic for people that come to me with gout is, I can fix this with diet alone. That's not true. You're not going to be able to fix this as a durable strategy for your lifetime with diet alone. So let's get that one fixed right now.
That's good, Chris.
So what about you, Gary? We were chatting earlier and you mentioned cherry juice. As an informed patient advocate, how often do you hear the myth that to solve an attack, you can just drink cherry juice?
You know, that one is, man, that's been around, I would think, for a while. In fact, when I first told my parents I had gout, they were not too surprised, but one of the first things they did was they went and sought after the darkest, the deepest, blackest cherries that they can find. And the darker, the more potent, they thought. And they bought it out of love for me. And I ate it. I love cherries. But the thinking was, the more I can eat cherries and just devour it, it would actually help my uric acid and it would help my condition. And unfortunately, that is another myth that we deal with all the time. And it's not an uncommon myth. We see that being talked about all the time, Chris, within our support group, right? People talk about that. And it's not just cherries.
What was the one that you had mentioned previously, something about vinegar? There was some other thing you're supposed to drink. Oh yeah, apple cider or something like that. Some people have this myth that if they drink apple cider.
Oh, I have heard about this too. Apple cider vinegar, yeah.
Oh yeah, right. So if you drink that, kind of like a Coca-Cola, just down it, it's supposed to clean the body and make you feel better. I tried it, Chris. Whatever it was, everything that we talked about, I've tried because it took me a long time to receive a diagnosis. As you know, as a physician, without receiving a diagnosis, you don't have access to the simplest of medications that are required to manage this condition. I'm sure we're going to talk about that.
Yeah, I'm curious, Dr. Elfadawy, from the nephrology standpoint, I don't know if the population is going to be a bit different when they come to see you, but are there particular myths about gout that you seem to hear regularly in clinic?
Oh, yeah. The biggest myth I hear is patient thinks they do something wrong. Like gout happens because they have poor lifestyle or because they eat stuff that they shouldn't eat. And for sure, this is a big myth. They don't realize that gout has a lot of genetic factors playing behind getting the disease. And most of them, they don't know that there is a lot on the kidneys to handle the uric acid. And a lot of kidney diseases can cause gout. So I try to explain to my patients that gout is not just lifestyle. It's not just diet. There is a lot to understand and talk about. Gary, before we get any further in our discussion, I'd love to hear more about your patient journey.
Yeah. Can you take us back to when you first developed gout and kind of walk us through your journey, not only in terms of symptoms, but getting to a diagnosis and then finally getting to an effective therapy?
Yes. Great question. Thank you for asking that question. So my journey with gout started in 1994. I was 24 years old, walking across campus, minding my own business, and then boom, I felt something in my ankle. Didn't think much of it. And then that evening, that little twinkle in my ankle just became worse. And ultimately, late that night, it swelled up and the pain was horrific. I remember thinking, what in the world is going on? It felt like a severe sprain and almost even a break of the bone. Wasn't sure what was going on, so I called my dad the next day and I said, hey, Dad, I don't know what's up, but I had this crazy pain in my ankle and I don't think I did anything to deserve the pain. And he says, Gary, I gotta tell you, son, I have gout. I think it runs in the family and I think you're blessed with it. And I'm like, whoa, what in the heck is gout? I've never heard of this thing before. And my dad says, well, you need to go to the doctor. Tell the doctor it runs in our family and then we'll go from there. So I went ahead and made an appointment with a PCP. It took me maybe a couple weeks, maybe a month to get in. When I finally got into his office, the pain was still there, right? I sat down, I spoke with him, and I said, hey, I want to let you know, I think I have gout. It runs in my family. My dad has gout. And he says, well, how old are you? I'm like, I'm 24 years old. I was walking across campus, and my ankle started to hurt. It swelled up, really painful. And he just looked at me, and he says, well, I can tell you, you don't have gout because you're 24 years old. You're too young to have gout. You might have hurt yourself and maybe not remember exactly what you did. And that was his explanation to me. And I remember sitting in his office and I thought, oh my God, I just won the lottery. And ultimately, over time, the longer I went without proper treatment, the worse the pain became. And each time the attacks, or what we call it flares, right? Gout flares. When the gout flares would come on, it would actually last longer and longer. When I would go to the doctor, and again, I would tell them, I think I have gout. And again, it was, no, you don't. The pain will go away. Or they'll give me a steroid shot, and then the pain will go away, and then we'll just move on with life. That was 1994 when that first flare came on. And it wasn't until 2010 when I finally was at my wit's end. I call it my rock bottom experience. And that's when I actually met you in your office. I found you just by grace. I was able to track you down and meet you. Walk into your office with crutches, I remember thinking, here we go again. I'm going to have to tell my story again, and I don't know what's going to happen. But immediately off the bat, there was something different with you. And so I spent 10 minutes with you, Chris, and I just kind of shared what I've been through for 16 years. And you didn't dismiss what my experience was. You didn't gaslight me. You said, well, it's really simple. We can figure this out through a blood test. And I couldn't begin to understand why it took 16 years for someone to just do a blood test. So that was the first realization that, oh my God, I truly had lost 16 years of my life. But when we did the blood test, I was diagnosed finally with chronic gout. That basically means that, my condition was pretty bad. I was experiencing flares multiple times a year. And my uric acid level came back north of 9, close to 10. And we suspect that it had been at that level for many years. And we immediately started talking about just management strategy. And thank God, during that time, you were part of a clinical trial on an infusion medication in 2010, which is now FDA approved. But yes, so all that to say that my journey was long. It took me 16 years to receive a diagnosis. I wanted to give up. And the reason why I'm here today is because I've realized that I'm not the only one living with gout. There's over 9 million people living with this awful condition. And I want to tell you that I understand your feelings. I understand the pain that you're going through. And I need to tell you there's hope. You can have a pain-free life with gout. All right. So there's no cure for gout, but you can have a pain-free quality life with this disease.
Oh, wow, Gary, your story is impressive. I already enjoyed hearing it as much as I was in tears because of all the pain that you are going through. But basically, this is classical. What you have mentioned is all what we hear from our patients, like your chronic pain, you're suffering, you're struggling to find a diagnosis. So, really, I appreciate you sharing this story, and I hope that will help different patients too.
And I want to unpack a couple things from your story, which is so dramatic, to get a little bit more application to other people who may not have it as severe, because certainly you had a very difficult case. One of the things that you said was when we're talking about diagnosis, I think that I do like to have people understand that there's lots of kinds of arthritis out there, right? There's wear and tear arthritis, there's rheumatoid arthritis, there's psoriatic arthritis, there's gout, there's pseudo-gout. There's so many things that doctors have to know and understand. And so the real way we diagnose gout with confidence, that's the key, is understanding first the story. And so in your case, you had such bad troubles over a period of a long while that I was able to kind of understand which joints were involved and then what happened and then what happened. I'm like, I need a blood test, right? I need to know that this uric acid is high to really firm up in my mind what's going on. And then also to share with the group, again, not everybody shows up in this particular state. We did start with the classic medications to manage your condition. So this is sure, but do good diet, of course. I'm not going to discount that, but it's a myth to think that's going to solve it. And so we implement allopurinol. I think we may have tried some other oral agents before became very clear that the pills that I had in my toolbox were inadequate, which got you to the IV medication you mentioned before. And I was lucky to have that trial going on. But sometimes I have trials, sometimes I don't. Long and short of it is I'm going to do whatever it takes to get that uric acid controlled. And then unwrapping that story about how bad it was at the beginning when you started your infusions, it's human nature when something happens to us to go, oh, well, I know that this body's supposed to heal, and I'm going to give it a second or, a finite period of time to see if it goes away. And if it does, I'm not going to the doctor because I've had diarrhea before and that went away. And I've had a cough before and that went away. And I've had belly pain that hurt like anything and that went away because we've all been sick before. And then if you take that one step further, and again, I want Gary to weigh in on this in your experience because the intensity of pain is so bad.
I remember just the state of mind I was in, just physically, I was a wreck. And then mentally, I was a wreck. I went from this happy-go-lucky, outgoing, physically fit person doing whatever I want to just being really closed and just really irritated, easily get irritated, not wanting to spend time with people. Hard to spend quality time with my son back then. And I thought, man, how many other people are looking for treatment or looking for answers and they can't find any?
So, Gary, what you mentioned actually about the mental state and maybe some sort of anxiety or maybe possible depression, actually, this is not at all surprising because as much as gout is a physical disease and it can cause physical pain, actually, it has a lot of psychological impact as well. Anxiety, of course, fear of unknown, when this pain is going to happen again, what I'm going to miss with this chronic pain. So I'm so happy that you touched on this part as well, because we need to spread the word that it's not just physical impact, it's mental and psychological impact as well. So thank you so much for sharing this. Gary, can you explain to our listeners how a gout attack feels like? Can you describe it to us?
So if you don't know what gout pain feels like, let me try to explain it to you. And this is just a layman's understanding of how gout works. When gout is unmanaged, the body produces high levels of uric acid, which basically turns into tiny little needle-like crystals when the blood is saturated or the uric acid level is above 6.8. And so the body produces these needles. It's literally needles. So what does it feel like? When enough needles are formed around the joints, the toe, the fingers, it can actually feel like little tiny men inside the body with pitchforks jabbing their way out. And it's relentless pain. So much so that I would be laying in bed and when a flare would come on, I swear, when I would have the fan turn on overhead and as the fan's blowing and the wind comes down and the breeze just goes over the affected area, you can actually feel the pain. You can feel the wind, which causes horrendous pain. The sheet, you're pulling the sheet over because you're kind of cold, but as it rubs over, just slightly, gently, ever so gently, lovingly kisses that area, it causes horrendous pain. We have women in our support group who have gout, and they will compare a gout attack or a gout flare to childbirth. And what do they say? They say that they're willing to give birth 100% of the time versus having a gout attack because it's easier to give birth. So, Dr. Elfadawy, as a nephrologist, how do you convey to your patients the importance of proper treatment for gout? How do you explain to them that if you're not properly pro-managing this gout, it's going to become worse? Right? How do you convince them that this is true? And once they accept the truth, how do you convince them to seek treatment? And when I think of treating gout, it's not just taking medication like the cold until the cold goes away and you stop. We're talking about a lifelong journey with medication now, right? So how do you convince somebody that, hey, now that you have gout and you understand the severity of gout, how do you convince them it's time to partner up with your favorite physician and you're going to be journeying with medication for the rest of your life?
So the problem, Gary, as you mentioned, is patients seek medical advice only when they suffer from pain. The problem is they don't understand that in between these painful attacks, the gout is going on and the crystals are going on and the gout crystals are deposited in the body. So I try to explain to them that treating the episodes and the gout flares is different from the chronic management or the underlying treatment. Imagine with me, as you exactly said, the uric acid crystals are everywhere in the body. So when it hit the joints, yes, this is what caused the pain. When it hit the nerves, yes, this is what caused the pain, but it can get to the heart, it can get to the kidneys, it can get to the eyes. That will not cause the pain, but we have to be aware of this and we have to take care of the gout even when there is no painful flares. So this is what we call chronic management of gout. It's different from the gout flares and the painful episodes. And yeah, most of the patients, when they understand this fact, they really take care of the gout on chronic basis. I also tell them it's a chronic disease. It's like hypertension and diabetes. We don't treat it just on flares.
Dr. Elfadawy, I really appreciate that answer. I'm curious about one thing that's probably different in your clinic than mine. So obviously everybody in your clinic has sick kidneys. And when pain is that bad, like Gary shared earlier, when it's that bad, how do you get your patients to not go to the medicine cabinet and take a bunch of Motrin or Aleve or Advil when something hurts that bad? Because obviously that's going to make their kidneys sick. So I'm curious how you get them to not do that, because I suspect a lot of them really want to.
Thanks, Dr. Parker, for this question. This is a very important question. So let's agree here. Pain is pain. When the patient is in pain, the first thing they will go for is just some pain medicine, regardless what kind of pain medicine. And most likely they will go with the strongest pain medicine they have in their cabinet. And unfortunately, these are the most available. And the ones over the counter, which is the NSAIDs or non-steroidal anti-inflammatory drugs, that comes as an Advil or Aleve or ibuprofen, etc., etc. So unfortunately, these medications are the worst for the kidneys. And as you said, my patient population is different because I am a nephrologist, as I said, and I already see patients with kidney diseases. So adding this kind of medication to their medication list, of course, that will affect their kidney function. So first of all, I feel the pain. I understand that we can help patients with pain medicine, but I go over what's okay or kidney friendly and what's not okay. So I try to give options, some other different pain medication that might be more gentle on the kidneys. And we have a lot of options, to be honest with you. Like, it's not just those medication that can injure the kidneys. We have relatively safer medications. And keep in mind, Gary and Dr. Parker, when we get the uric acid under control and when we manage this on chronic basis, not just on the acute flares, most likely these painful episodes will get less frequent. So most likely they will not use these medications as frequent as they do. And after all, this is all helpful for the kidney health.
So Dr. Elfadawy, help me understand how important it is to control hyperuricemia, meaning high uric acid levels in gout, just in terms of kidney health.
So uric acid is crystals, and these crystals can go everywhere. Part of where these crystals can go is the kidneys. And actually, a lot of times when we do kidney biopsy for a reason or another, we see this uric acid already in the kidney tissue. So, as I always say, these uric acid crystals are atherogenic crystals, meaning that it causes inflammation. Wherever these crystals go, they cause inflammation. So let's imagine these crystals will go to the kidney, it will cause inflammation in the kidney tissue. Let's imagine these crystals will go to the blood vessels, that will cause inflammation inside the blood vessels, which can cause atherosclerosis down the road and coronary artery disease, heart disease. So taking care of the uric acid in general and dropping the uric acid in general, that adds a lot to the kidney health, especially with patients who already have some chronic kidney disease in the background. I would also like to add one of the myths that we hear about gout is it's a joint disease. That's why most likely rheumatologists are the main team that takes care of the gout. But I want to correct this fact and say that gout is not just joint disease. It happens that it just can manifest as joint pain if the crystals end up in the joints. But actually, gout is more like systemic disease. We have a lot of data showing that hyperuricemia and gout is a risk factor for hypertension, risk factor for kidney failure, a risk factor for heart disease, a risk factor for early onset type 2 diabetes. So I want to spread the word among patients and population that gout is beyond the joint. Gout is just not arthritis. It's more like a systemic disease. And as I always say, it's a chronic condition, exactly like hypertension and diabetes and chronic kidney disease. It happened that patients seek attention when they have the joint pain. But unfortunately, the other problems are most likely silent until the extended damage happens. So please keep in mind that gout is a systemic disease. It's not just joint disease.
And when you think about gout and the pain goes away and people forget everything that they just experienced, I think it would be helpful to remind people that untreated gout can affect not just quality of life, but the length of life. Dr. Elfadawy, during the 16 years when I wasn't able to receive a diagnosis, I actually had to rely on over-the-counter medication. And I was taking Naproxen like candy because that was the only option I had, and that was the only thing that would give me relief from the pain. And over time, I think my kidneys were affected. I believe I lost about 20% of the function. That's something I would love Dr. Elfadawy to talk about. How important is it to get proper treatment and without proactively managing gout and you're relying on other medication long term? There has to be some negative effect. I think it's important to touch on that.
Correct, Gary. So part of the negative impact of gout is how we manage the acute flares. Most of the medication that used to manage acute flares are not kidney friendly, as you mentioned, naproxen and this kind of medication. They are all have their own side effects on the kidneys. So imagine with me if we just treat the root cause. What is the problem from the beginning? The problem from the beginning is high uric acid. The uric acid is high for a reason or another, most likely because the kidneys are not handling it well. Let me tell you, Gary, before I go forward, the kidneys are the only organ that can get rid of the uric acid that we consume. So whenever we eat, we generate uric acid. The only way to get rid of this uric acid is through your kidneys. So if the kidneys are not doing good job doing this, the uric acid will build up, and this is what will cause the problem. When the uric acid build up, these are the crystals that will deposit and cause the pain or the systemic manifestation that we just talked about. So if we can treat the root cause, if we can get the uric acid under control by medications, and again, we have a lot of options for medications between oral medications and intravenous infusions. If we can get this uric acid under control, the flares will not happen in the first place, and then we will not need those medications, which mostly are not kidney friendly, to manage the flares. So again, that will take us back to the fact that chronic management of gout is more important than managing the acute flares. So again, let's look into this as a systemic disease, not just flares and joint problems. So for the reasons I mentioned, Gary, this is why patients often see a variety of doctors between the primary care, the rheumatology, the nephrologist. Let me tell you the typical scenario for patients like you. So patients like you will experience gout flares, severe pain. They will end up two things. Either go to the ER will give them some pain medicine, the pain will go away, patient will forget about it, no one will ever remember that until they get the second flare, or the patient will pick up the phone and call the PCP, and the PCP will put a prescription for pain medicine. 1 week or so, the pain will go away. Next time you will see your primary care doctor, most likely you will forget to talk about what happened because you will not be in pain when you see your primary care doctor. So this problem and this typical scenario lead to misdiagnosis or non-prioritization of the problem, or this problem will get missed. That's why we think gout, in spite of being a very serious chronic condition, it gets a lot of misdiagnosed and undertreated because of this reason. So patients with gout will likely see multiple teams until they figure out what's going on and until they get the appropriate treatment. Dr. Parker, what do you think? Do you want to add anything to this too?
Thank you for asking. When somebody's having horrendous pain in their toe foot, ankle, knee, wrist, whatever. At the beginning, they don't know why it's going on. So it'd be completely reasonable to make your first visit with your primary care doctor. That'd be fine. You might say, well, it's Saturday and it hurts like anything. I'm going to the emergency room. I'm going to urgent care. Or I'm a kidney patient and I see my nephrologist real regularly. I'm going to start there. I have access to him. Wherever you start, that's fine. And for sure, one of the overreaching paradigms of tonight's talk, I hope, is number one, don't just sit on it and do nothing, right? This is not the time to do that. And you could start anywhere you want. And if you are getting good results with your primary, with your, as I see it, your nephrologist, it could be somebody else, your cardiologist or podiatrist, they see tons of gout and they may feel very, very comfortable diagnosing and treating. And if it's going great, meaning it turns off the attack and then you get on preventative therapy and then you stop having attacks, everybody's happy, right? And so a lot of people want to understand, why would I ever need to see a rheumatologist, a subspecialist, basically? And in my simple mind, the answer is, if you and your doctor, whatever doctor that is, are doing the best they can, but not getting good results, it doesn't mean you don't like them. It doesn't mean you don't trust them. You're just not getting the outcome.
So I agree with you, Dr. Parker. If the patient is not their own advocate, actually this can get missed easily. Patients should speak about it, should look for some help somewhere. I know there is some help somewhere. Even if they don't find it from the first visit to this specialty, they can look for other specialties. And again, as we said, gout is managed by different specialties. PCP can take care of it, podiatrist can take care of it, nephrology can take care of it, rheumatology can take care of it. So if you don't find your comfort or your management at one certain specialty, don't stop there. You have to keep going. You have to talk about it even if you don't have flares. And again, you will not remember to talk about it when the flares go away. So you need to keep it in mind, put it on your list of questions that you will ask your provider about. Hey doc, I had this gout flare 2 months ago. I don't feel anything wrong now, but what should we do next? That should be the message to all patients. Please don't forget about gout. Gout is a chronic disease.
You know, as a patient, we need to learn how to find our voice. We need to feel empowered to say, hey, stop. This is my life, and I just don't feel like I'm getting the care that I need. And it's okay for us to voice up and ask for a second opinion. We're just talking about a second opinion. It's not like I'm saying you smell or you're ugly or any of that. You know, like, it's nothing personal. It's finding your voice and saying, hey, listen, we might not be connecting. And so get a second opinion. And I got to tell you, this is a real issue because for me, I never want to offend people. I'm just a nice guy. I don't want to offend people. And that cost me 16 years of my life because I just didn't want to push back. Well, I'm here to encourage people that have gout to find your voice and push back if you think you need to. And it's okay to push back because we're talking about your health and your well-being. So when I think about my journey and how I felt when I finally was able to regain my quality of life and back in control, like, I'm no longer the co-pilot, but I'm the driver, of my own life and destiny. It felt amazing. I mean, I felt like I was in prison for over a decade with no hope and no understanding from anybody. And to be able to regain that, can you put a price tag on quality of life and pain-free?
Thank you, Gary, for sharing. And all what you mentioned is reasonable. And I'm happy that we have the patient point of view with us today. So I wanted to mention that we support peer group therapy as well. Since gout is a chronic disease, talking to patients with gout, that might add some support and some comfort as well. Since we are talking about getting gout under control, Gary and Dr. Parker, would you tell us more about your organization?
Thank you for asking, Dr. Elfadawy. So when Gary got well, the place this started was he shared his frustration in my office about how many myths and fairy tales were out there that he was told to do to manage his gout over the many years, as he explained earlier. And he said, why isn't there a support group to help people know that these things don't work? We started having these quarterly Saturday meetings at my clinic, right? People could come in and we would just talk to them about real science and real experiences with people with gout, giving hope. That's the primary mission. 1, give people hope that this is doable. 2, debunk these myths and fairy tales and folklore about gout. That was it. We're not promoting any meds or anything like that. We just want to fix those things.
Thank you, Chris. If you are living with gout, you don't have to be alone. I know this disease can be very isolating. I want to say, if you have gout, it's not your fault. Secondly, you don't have to be alone. Okay, there's power in numbers. We have 16,000 people that are living with gout that are members of the Gout Support Group of America that can offer support, offer hope, and you just don't have to be alone. So you can find us on goutsupportgroup.org. You'll see us, and we are happy to connect with you.
Thanks so much for sharing this, Gary. And it was great actually to hear from Gary as a patient and from Dr. Parker as a partner that you guys have worked together to create a different level of support to our gouty patients. And I'd like to add for the newly diagnosed patients with gout, I wanted to tell you that you are not alone. You have a lot of support around you. You have a lot of medication options, and you have a lot of different teams that can take care of your gout. We feel your pain. We understand how miserable this pain is. And my advice to you is just speak up, just be advocate for yourself, look for treatment around you, and eventually you'll find it. And again, thank you, Dr. Parker, and thanks, Gary, for sharing your experience and expertise with us today.
It's been a pleasure to be part of this. So thank you for having us.
And thank you for choosing us.
And that brings us to the end of this episode of The Gout Show. This podcast was made possible with support from Amgen. We hope the stories, insights, and voices we shared have touched you, educated you, and made you feel a little less alone in your health journey. If you enjoyed today's episode, be sure to subscribe to The Gout Show on your favorite podcast platform. And don't forget to leave us a review. Your feedback helps us improve and reach more listeners like you.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.